the home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
countries across the globe have been hit by the COVID-19 virus.
Views,
there's a global trend to see an increase in GBV incidences, specifically domestic violence.
Sports,
What's he say? It's a really good ball. It's Shabalala.
And music to inspire you every day. This is Vuga Online, your inspiration radio station.
Hi there, and welcome to Healthcare Hour with Colleen Qvist. How's your week been? Thank you for all your messages. It's so good to hear from you. A special shout out for all of you in America today. We are thinking of you, and it's great to see how many of you stream VUCA, how many of you stream Healthcare Hour with me. So yes, it's interesting how small the world's become. And my guest today is also about how much smaller we can make the world, how AI and technology has come in. But before we do that, of course, let's hear more about the show. Healthcare Hour with Colleen Qvist, that's me, is all about healthcare professionals. It's about us understanding that healthcare professionals are people. They get tired, they get hungry. They would also like to see their families. It's also ensuring that we improve the relationship between the healthcare professional and the patient. As you know from many of my shows, I talk about communication. I talk about, gee, if we could just say, hello, I'm Dr. So-and-so, and what we're going to do. But yes, that seems to be a gap. And then, of course, we're also there to talk about how to improve the relationship with the family. And as patients, we can't just be little blobs sitting on the couch or actually in the bed, in the hospital bed. We need to have autonomy on our own healthcare. We need to know what's happening. And I'm amazed when I ask patients, oh, what did the doctor say? They say, I don't know. What did the nurse say? I don't know. What did the physiotherapist say? Oh, I don't know. So it's important, back to the communication, that we also communicate with each other so that we are understood, as opposed to, well, I told you. The fact that it didn't land, yes, that's the important bit. But yes, on that, when we come back from our break, we're going to meet my guest and we're going to hear about advances in technology, which specifically apply in this case to healthcare. But let's go for that break.
How do you know the life of personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You are tuned to Healthcare Hour with Colleen Qvist. And my guest today is Doug Reed, or maybe he prefers Douglas. Let's hear from him.
So, yeah, Doug Reed is my name. I'm an engineer.
Okay. Yes, you're going to tell us all about yourself. Okay, Doug. So, yes, you're an engineer.
I'm an engineer, and I studied at the University of Witwatersrand in aeronautical engineering. And I landed up having a South African Airways bursary. And I was traveling the world extensively in South African Airways. And at that same time, I realized that a lot of senior executives from South Africa were traveling up to London. And they were tired of it because they were going to board meetings and then fly back the next night. And it was becoming a pain. So that's when I realized virtual movement had to be the future. And we're talking about in the 1980s, late 80s. So that industry eventually became video conferencing when enough bandwidth was around. People were starting to use it, but it really took off during COVID. But the problem with it is that you had the Zooms and the Teams and the WebExes, and they were all free services. So the actual video conferencing industry per se actually died from a financial point of view. And that's when I realized that maybe there's another place for video conferencing, and that was in the healthcare industry. And that combined with the fact that many doctors, patients were tired of traveling. And I sort of worked together developing this technology to actually allow patients to come to clinics and doctors to actually diagnose them remotely from their homes or wherever they might be. And that's how I got into this industry with healthcare. So I've been in it for about 3 or 4 years, learned a lot about the industry. And it's quite a challenge to work in the industry. Yeah.
Yes.
Yeah.
Okay, so yes, engineering background. It's always fascinating when you bring, we get rid of silos and we bring in technology in one, from like engineering, and then say, how do we apply it here? How do we apply it there? How do we bring people together?
Yes.
Yes. It's also fascinating to see as well as, like where we come up with technology, like you say, like in the 80s, and then people look at you as if to say, no, come on now, which fairy tale are you living in? And then a few years later, well, in the beginning, it used to be a lot of years later, and now sometimes it's just a matter of a year. And then zip, the technologies, yes, it's there.
Yes. So the way I see the medical industry, it's a very, very siloed-based referral type industry at the moment, in that if you go to see a nurse, she might refer you to a doctor who might refer you to a specialist. So I'm going down the road of a simple thing called hashtag care together, similar to the Springboks in that they had hashtag stronger together. So I see the industry actually cooperating, everybody working together, nurses, doctors, specialists, and even patients, and creating this circle of care. And
Yes.
that's what our technology starts to bring to the industry as such. Is actually everybody can see one another, chat to one another at the same time with minimizing or reducing the number of referrals that have to happen in the industry.
Yes.
Without actually people traveling. I see things like knowledge and information must travel, not the clinician and not the patient. So that's the sort of technology, and I see that as the future of healthcare delivery. Yes.
Yes. So in that future, you're also then putting the patient at the center, and almost everyone is then checking in. Everyone then has the patient's needs and what they need at the center of things. And then, so it's patient-centered care, but you're also making sure that the patient doesn't have to, okay, now in your car, off you go, get an appointment 6 weeks later, that kind of story.
Yes.
But
Yes.
you also, you're also making sure that the doctor doesn't have to hop in the car,
Correct.
come consult you. Yes.
So there's lots of instances where doctors don't want to travel over weekends, at late at night for security issues and all the rest of it, but they still want to give care. So a technology like our platform allows them from their homes to give care right back into the clinic or back to the hospital in real time. And that's another important advance that I see moving forward, is that this real-time care, it's not the situation where a patient takes his vitals and uploads it, and then a couple of hours later, the doctor looks at the vitals and makes a diagnosis. I see this real-time, non-referral type care delivery starting to come forward in our
Yes.
health. Yeah. So, yeah.
Well, I think what's also important there is that, you could say, okay, take my blood pressure, but did I take it properly? And then also it was 100 and something over, what was the number? And then maybe I don't write it down right, or, it's a few minutes, or the phone rings before I write it, and then, it's a very higgledy-piggledy number that I end up writing down. But it's the number that the doctor's got to work with.
Yes. So that's exactly it. You're preventing re-recording of measurements and things like that. And the doctor in real time can actually get a reading, and if he sees it's wrong because the blood cuff was put incorrectly on the arm or something like that, he can actually get the person to change the position and then get a proper reading in real time. So
yes,
and that's part of the patient sort of experience, that you're not telling the patient to come back to do another reading. The patient can get the reading there and then. And also there's an element of upskilling that can happen too between the doctor and the the community worker in the clinic, and that they can sort of on live real time actually upskill the people that are delivering healthcare in the community.
Yes. So we'll dig in more into exactly how it works. But so there also in South Africa and obviously in other countries, you've got clinics and hospitals, I suppose, in rural kind of areas. And also you've got big companies like mines.
Yes, exactly right. So I see, Colleen, might be a little controversial, but I see generally today you've got the general admin type hospital where people go to. I see that sort of healthcare delivery changing, where you're going to have multidisciplinary clinics, which will be going to be positioned further and further away from the hospitals and closer to the patients, and hospitals converting into a specialized type hospital. And a lot of the work will be done in the multidisciplinary hospital, where people will then be referred to a specialized hospital. Also, we have issues that I've discovered is that there's lots of referrals that are done from clinics to hospitals that are not actually necessary. And with technology that I'm talking about, you can reduce those number of referrals. Because the specialist can say, no, if you do this and this and that, there's no need to actually refer the person to the hospital. So that's what I'm talking about, care together. Everybody starts working together, specialists, the nurses, the doctors, to start help reducing the delivery cost of healthcare. That's what I see. Yeah.
Okay, so exciting times.
Yes.
So yes, let's excitingly go for our break. And when we come back, we're going to hear more about, because maybe our audience is sitting there going, huh, what are they talking about? So let's break it down after the break.
The Africa Center for Work-Based Learning is a professional development center for professionals who aim to improve their professional standing. This means that the learning programs we run are more than just academic programs. They are work-based programs that focus on leveraging your current experience as a professional to build your overall profile. A year down the line, the Africa Center for Work-Based Learning is developing into a preferred center for professional development in Pretoria, with 8 professional development faculties including accounting, teaching, entrepreneurship, as well as IT and...
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Doug Reed. Doug is the CEO of Atlantic Advanced Technologies, and we've been talking advanced technologies. So it might have all sounded a bit higgledy-piggledy to you. I had to get my head around it. But so what we're talking about is real-time, the collaboration. So it's healthcare, which includes streaming of medical instruments.
Correct. Exactly.
Okay. So let's picture this. We are out in a clinic somewhere. The patient goes to the clinic, and there's maybe a nurse there. Okay.
Yes.
And to take us through that.
So here's an important part: is a lot of patients in rural areas arrive at the clinic on an ad hoc basis and wait a whole day. So our platform allows that patient to actually create an appointment and arrive at the clinic at a specific time of the day, and therefore reduce their potential loss of earnings. So that's the first part. And then at the clinic itself, we have a device, or it's actually a PC, a Windows PC, with a whole lot of medical devices connected to that PC. And with the ability to be connected to remote doctors or specialists. Those doctors that can be anywhere in the world can connect to the clinic via a PC with a browser. So there's no need for download of software or anything like that on the doctor's or the specialist PC. It could even be a tablet, or it could even be a mobile phone. So there's nothing special about it, the doctors. We can literally have thousands of doctors connected back to the platform at the clinic. The nurse will then be able to do some sort of basic diagnosis, like vitals and things like that, and then have the ability to call a doctor out by sending an email/SMS, and then the doctor can actually connect and actually have a look at the vitals and do a lot of that sort of basic diagnosis first, and then connect to the clinic. And then the doctor will actually see the patient and the nurse on the right-hand side of the screen. And then on the left-hand side of the screen, the medical devices will stream to the doctor. So if it's a stethoscope, the doctor will actually hear the stethoscope. Or if it's an ultrasound, the doctor will get the image, live image from the ultrasound, and then capture this information to be uploaded into an electronic health record platform for future technologies like artificial intelligence and things like that. Yeah.
Okay, so all right. So what I'm seeing here is the access, and that it's not reported. Well, I think I listened to the heart, and I think I heard a murmur, as opposed to hear it yourself. Okay.
Correct. So the doctor's making a diagnosis, or the specialist is making a diagnosis on what they believe to be the problem, rather than getting information from the clinic. So
Yes,
it's reducing
playing broken telephone.
Yes, exactly right.
Okay. And then also the system is then capturing the information as it happens. So there's no get my pen out, what was the story now?
Yes, so that's also an important part in my travel in the medical industry. Most of the people got into healthcare, whether it's a nurse or a doctor or a specialist, to deliver care. They didn't get into the industry to become admin clerks.
Yes.
And a lot of their time is now consumed by admin clerks, being admin type of things like capturing data, etc. So in our platform, we have the ability to go from speech to text, and I call that keyboard liberation. So you can actually capture somebody's information. You just ask them to talk, and it'll actually capture that speech to text. And then that can be uploaded into an electronic medical record platform. So, yeah.
So you could also capture the patient's history then?
Yes, you've got all that in the electronic medical record platform, but you can typically ask the nurse can ask the patient what is wrong, and you can actually capture in text format what the patient actually says. So that, again, you're not having this broken telephone. And then the nurse can also then capture what she thinks the problem is and do some sort of diagnosis. So now you've captured the interaction between the nurse and the patient itself. And then the next step is obviously the doctor can capture his diagnosis or her diagnosis. It's allowing less admin time and more time for care.
Yeah. Yes, and you're quite right in doctors complaining about all this admin. If I wanted to be admin, I would have signed up to be the bank clerk, you know. And I think people assume that banking has got admin, not healthcare should just have people and care.
Yes. And that's one of the main reasons why doctors like our platform. Apart from the fact that they don't have to travel, they can still deliver care at night time, over weekends. They've reduced their admin burden that they've got on them. And they can do what they want to do. Yeah.
Yeah, and I also think an advantage, you know, I know quite a few doctors who have moved into different areas of medicine out of clinical. Or, you know, one doctor I interviewed at the beginning of the year, he works from home. So it would also be fascinating for him where he could be backup for around the country, for instance. I mean, it doesn't matter where the patient is.
Yes, and it goes further because a lot of people have to retire at a specific age, like 65, and then they go off to the coast and they want to...
And sit on their stool?
Yes, and then we know what happens with that kind of thing. So they want to keep their hand in. So there's no reason why a doctor can't work on a Monday and a Wednesday and play golf on a Thursday and do other things on a Tuesday. So at least they're not overburdened with their medical practice, but they can still at least keep their hand in on a Monday morning and a Wednesday morning, and then still use their expertise and skills to give to people anywhere in the world. And so you've got all those abilities that you're not locking in a specific set of people. You can pull your experts in from anywhere, your retired people.
Yeah, so not only are you having, okay, so this is all recorded. So we've got patient X's details. So we could then have a, you know, connect to care, as you say, a meeting of the different, you know, here comes the dietitian here. So I'm thinking, for instance, in step down, where you have the dietitian weighs in, the occupational therapist, the doctor, the physician, the everybody, all has their say about patient X.
Yes, because we're, as a human, we're very complex machines, and everybody's got an input into it. So that's hashtag care together. There's no doubt about it. There goes another step, Colleen, is that if we deploy our systems into retirement homes, we all know that lots of young South Africans are leaving the country. So now you have the ability for a doctor to actually do some sort of diagnosis, a doctor sitting at home doing a diagnosis of a person that's sitting in a retirement home. But that doctor can bring in a young family member that's living in Australia or in England or United States. And then you've got a three-way video consultation that can be going on in real time. So there's all those sort of benefits that call it globalizing healthcare delivery. And bringing
so quite fascinating. Because I hear often from the younger people, well, not always younger, but the next generation who does live overseas, and they almost saying, oh, but mom and dad are still in South Africa, and then there's such a gap of like, did they go to the doctor? Who took them to the doctor? So then it's also a way now where you could have it even in a clinic. I mean, in a retirement village.
Yes. So that's that circle of care that we're talking about here.
Yeah.
And that's what a platform like ours does here.
So you do get lots of businesses that are big businesses. You get big, my dad lives in a big retirement home. Yes, and obviously all your mines.
Yes.
So lots of different applications.
Yes, so that's another sort of facet, is that people are absent from work. If you can catch the person that's been absent for, say, 3 or 4 days and then come to see the company doctor, you can get an indication of what's wrong, and then you can probably try and get them fixed so that they can reduce their absenteeism. So that's another facet to a platform like this, without actually having that company doctor at a mining shaft, because you don't need that doctor there all the time. So the system allows to bring efficiencies. One doctor can be looking after 6 or 7 mine shafts, from a central place, and that first place could be at home, or it could be anywhere.
Yes, so quite exciting. Of course, with anything new or any kind of application, people go, oh, but it can't work. Doug, you're crazy. It can't work. And it always fascinates me as well to see, I'm sure when the car came along, they said, no, can't work. There's nothing wrong with our horse and our donkey.
Yeah. So along those sort of lines, and normally the forward-thinking sort of people are the universities. We've got a system deployed at one of the South African universities because they start to see the benefit, not only from a patient thing, but they also see it from an education point, in that you can have a specialist helping and guiding and upskilling a doctor is sort of that's in training in that. Some of the corporates see the advantage of it. Some of the big hospital groups, we're chatting to one hospital group at the moment, engaging with them. So they also see that the delivery of healthcare is changing in the world at the moment, and not just South Africa. It's a global drive, and that's what we see here.
Yes. Okay. So on that exciting point, let's go for another break. We've got lots of exciting points. I think technology is very interesting, and what can we do with this? Yes. Let's go for a break.
How do you know the life of personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Hi there, and welcome back. You are listening to Healthcare Hour with Colleen Qvist. My guest today is Doug Reed. He is the CEO of Atlantic Advanced Technologies, and we've been talking technology, surprisingly not. And we've been talking about a system that allows, as he said, #care together, in that it's bringing together all the different stakeholders in a situation without them being physically together.
Correct.
And he was explaining to us that, for instance, you could have a patient going to a clinic, and then from there you have in real time, because not only are we, streaming pictures of, hello, here I am wearing blue today, we're also able to stream medical instruments.
Yes, and things like ultrasounds, colposcopes, ECGs, 12-lead ECGs, they can live stream. Yes, correct.
Yes. And so also what happens is a lot of our doctor colleagues complain, a lot of our healthcare professionals complain about, good grief, I didn't sign up to do admin. I signed up to care for patients. And this also reduces the load of filling in little pieces of paper.
Yes. Yeah.
In triplicate.
Yeah.
Yes.
Keyboard liberation.
Keyboard liberation. Okay, we need hashboard keyboard liberation as well.
Yeah.
Yes. So now, Doug, as we, I know like when we problem solve and we're trying to work out, okay, how could we get it to work? A lot of people don't focus on, right, here's the technology, how can we get it to work? They focus on, oh no, but that couldn't work because.
Yeah, so our model is very much that we put the infrastructure at the clinic itself and we monitor it and manage that infrastructure. So it reduces the burden on the actual clinic or the healthcare professional at the clinic itself to manage that infrastructure. So we're in a healthcare infrastructure business rather than a healthcare delivery. Somebody else provides the services like the hospitals, like the doctors that are sitting in Knysna or George, wherever it might be. That's their skills. Our skill is actually the infrastructure skills. And that's what we're doing.
And obviously being the backup and being on this call of, oh, I can't get a picture. Yeah, I know also with equipment, often standing in theatre where you would have the equipment rep standing there because it's almost like, no, where's the picture? Or my picture's fuzzy or it's got lines in it, I'm thinking about, for instance, with scopes. And then they go, chick, chick, chick. Yeah, and change it.
Yeah, so what we do is that we're continuously monitoring the system in the clinic itself. In fact, we're checking every 60 seconds. And if we don't see that after 3 goes at not seeing it, it automatically generates a help desk ticket on our platform. So our technicians are able to proactively find out what the problem is and start dealing with it, not waiting for the healthcare professional to start using it, and then it becomes a crisis. Yeah.
But that's also a great point because, I sold equipment in the olden days into rural areas. And it's also about, oh, my blood gas machine doesn't work. And then you go, oh, okay, well, I'll have to find out what's going on or send you a technician or do whatever. Okay, how about the week after next?
Yes, yes.
Yeah.
It's this proactive part of it. So, and that's kind of where I'm coming from. It's preventative healthcare, being proactive about it, because somebody might be getting sick and that you might spot it after 3 or 4 days. And then you can start dealing with it on a preventative basis rather than waiting for a healthcare crash, for a better word. So it's the same thing with the technology. We're proactively monitoring it. And if it's not working, we can get hold of the clinic, find out if there's electricity, connectivity, whatever it is, and deal with it. So it's available to the healthcare person when they want it. Yeah.
Okay, and speaking about connectivity, how do we get these images?
Okay, so it depends where you are. If you're in an urban area, it can be fiber optic connectivity. It could be 4G LTE type connectivity. But if you're in an area where there's no connectivity, there's a new technology called low Earth orbit satellite connectivity. And the most famous one at the moment is Starlink that everybody talks about. But there are other service providers. So we literally can go anywhere in the world with our platform.
Okay. So by hook or by crook, we'll get it to you somehow.
Yes. Well, more than hook or by crook, we can definitely go there. It's a real time.
And it's not waiting for the pigeon to be in town. Please take it to yes.
And it's a real time experience, so that when you talk, you get a response back almost immediately from the clinic. Because as human beings, we talk full duplex, and others we talk on top of us. We don't talk like the old radio. I'm talking, it's over. You now talk, it's over. We talk on top of it. It's full. Everybody's, and that's the type of connectivity that low Earth orbit satellite brings to healthcare. So that's
all right. So now, as you were saying earlier in a previous segment, you were saying, okay, we can call the doctor, and the doctor will answer. Okay. Yes. Now, what happens when the doctor's doing something else?
Okay, so we've got like a virtual sort of list of all doctors that are on so-called on duty, whether they're watching
Okay.
the rugby or not. So you obviously, if a doctor's already busy with some other consultation, that person automatically gets taken off the list. And then all the other doctors are available. So you would choose a doctor. And that might be a patient want to see a specific doctor. You can choose that. And then it'll send an SMS and an email to that doctor. So whatever that doctor's doing will get an SMS on their phone, and they'll know that there's a patient XYZ waiting for the consult. But the beauty about it is a lot of the pre-diagnosis has already been done by the nurse. You know, the vitals, done the stethoscope. So that doctor can actually go into the platform, listen to the stethoscope, look at all the vitals, sort of be pre-warned of what the patient is, can see what the patient is presenting as in terms of what they feel the problem is, what the nurse thinks is, and then connect via video. So the doctor's consultation times can be reduced dramatically. Typically, it's in the order of 25 to 30 minutes. You could have a scenario where you've got the nurse doing a lot of the work and the doctor only doing 10 minutes of consultation. Again, hashtag care together. Yeah. Everybody's helping one another. Yeah.
Yeah. That's also criticism at the moment, because sometimes doctors have specialized in 8 minutes of, hello, who are you? Okay, right, out the door. Yes. And it's also, well, it's about making sure that you get the information and then consult with the information and then talk to the patient.
Yes. And it goes further in that if the doctor can actually do his or her diagnosis with keyboard liberation, that doctor's got more time for care. So one has to look at, I guess, that 8 minutes. What is the doctor actually doing? If it's an admin function, or if it's a, diagnosis, care, it's all those things that we're trying to give more time to the doctor for care and the nurse. Yeah.
Okay, and then with this keyboard liberation, is it possible to then log in and also have the medical aid as or medical aids?
So our platform is a consultation platform. Once you've done the consult, then you upload it to an electronic medical record platform.
Okay.
Now, that medical record platform could be a medical aid platform. It could be a actual healthcare platform. So we don't mind. We'll ship it to anybody who wants it. So we don't hold on to any consultation information. We ship everything to whoever wants the medical data as such. So
yes.
Yeah.
Yes, and then in terms of shipping it, I pictured people, the pirates stealing it. What safety measures are built in here?
Oh, okay. So in the medical world, you've got a protocol called HL7v2, sorry. And that's a secure mechanism to transfer medical data. So that's a well-known international standard to actually do that. So it's no way can anybody tap into that medical information that's traveling from our platform to the medical record platform. There's no way.
And if anyone can tap in, they can come work for you and build the next firewall.
Yeah.
Yes. I've learned to never say never, because people take it as a challenge.
Okay, maybe, but it's a pretty standard way of transferring medical information. So yeah.
Okay.
Yeah.
All right. So lots of different applications, lots of different ways of hashtag care together.
Yes.
And then also interesting to see that, you seeing primary healthcare out in rural areas moving into the center, and now saying, no, we're going to be able to, instead of moving the patient, we're going to move the information.
Yes, that's what I say. Information and knowledge must travel, not the clinician and not the doctor. I mean, not the patient, sorry. Yes.
Yes, clinician, doctor, and patient.
Yes.
Yeah. Okay.
So I see there's an upliftment of clinics to a multidisciplinary type clinic scenario. And I see the hospitals in the future changing from a general type hospital to a much more specialized type environment. That's the fundamental trend that I see globally.
Okay.
Yeah.
All right. So, well, thank you so much for coming to share with us.
Yes. Thank you. It was
Yes.
really enjoyed it. Yeah. Thank you very much, Colleen.
And if anyone wants to get hold of you, obviously they can look you up on LinkedIn. Yes, they can find you very easily. Doug Reed, and Reed is R-E-E-D.
Yep.
Not the reading kind. Yes.
Yeah.
Okay,
Thanks.
so yes, thank you.
Yeah. We'll chat soon. Yeah.
Yes. All right. So you have been listening to Healthcare Hour with Colleen Qvist. Thank you very much for joining me. If you have any comments, if you have any criticisms, of course, because yes, let's hear from you. If you have any questions for Doug, or you would like a demo of this equipment, please reach out. We're here. And please remember as well that you're loved, you matter, and you're not alone. And I'll see you next week.
Thank you very much, Colleen.
Bye.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What do you say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.